I'm a Liberal Democrat. I care passionately about the NHS. If I felt that this legislation would lead to the privatisation of the NHS, as the critics claim, if I felt this legislation were to lead to the ruin of the NHS, of course we would drop it. The truth is that at the heart of this legislation is a very simple, straightforward idea, and it is this. It's to give people who know patients the best, doctors, nurses and clinicians, more say about what happens to those patients and how the NHS is run. And I think that basic, simple idea is a good one.
So you are behind this 100%?
I am behind reforming the NHS to improve the care for patients. Of course, I understand people working in the NHS are wary of change, and we must continually work with people in the NHS to make sure these changes are successfully implemented. But I really do think we need to separate fact from mythology. Some of the claims made by the Labour Party are simply outrageous. For instance, their claim that this would lead to privatisation is extraordinary, coming from a party, the Labour Party, when they were in government. They entered into sweetheart deals with the private sector, explicitly designed to undermine and undercut the NHS. We are outlawing those sweetheart deals with the private sector and the NHS.
But you know it's not just the Labour Party, is it? It's GPs, it's midwives, it's nurses, it's people who also want a better NHS for patients, and that's why they say they're against reforms. I wonder what you're hearing that they're not, because they don't agree with you.
Well, I spent a lot of time talking to many of the Royal Colleges over the spring and the summer when, as you remember, we paused the legislation, not least at my insistence, and changed it very, very considerably. We changed it radically. We've outlawed, as I said earlier, any kind of sweetheart deals with the private sector. We are legislating for the first time to make sure that outcomes in the NHS are more equal for both rich and poor. And I think, of course, I understand that any change to something as precious as the NHS is controversial. I totally understand that, but I really do think it is worth stepping back for a minute and considering what the legislation is actually proposing. At the end of the day, what it's proposing is quite simply a transfer of authority so that there is more power in the hands of doctors, nurses and clinicians to decide how the NHS works, what's best for patients and how money circulates in the system.